Thank you so much for joining us for this News 12 coronavirus special report. I'm Amanda Bossert.
And I'm Jessica Cunnington. Coronavirus, of course, has really dominated a lot of the conversation in and around New York City, especially over the past few days as new cases continue to be reported.
And tonight we are breaking down this outbreak and what it means for you. We have two medical experts live right now in our studio, ready to answer any questions that you might have about coronavirus. The number to call is 718-861-6827. We're also continuing the conversation online over on our Facebook page right now, where doctors are responding to all the questions that are coming in via comments there.
But joining us right here in studio tonight is Dr. Inessa Gendlina. She is the Director of Infectious Disease and Infection Control over at Montefiore Health System.
And Dr. Michael Augenbraun, the Director of the Division of Infectious Diseases at SUNY Downstate Health Sciences University. Thank you both so much for joining us and for having this important conversation with us tonight.
Thanks for the invitation.
Thank you for having us.
Of course.
And to begin this evening, we do want to hear from each of you just to kind of set the tone here. What do you think is the single most important thing you hope our viewers take away from this special tonight?
I guess I'll start. I think there's a lot of anxiety out there, and I think that part of the reason for this program is to address that. And I would say that people should not be so anxious. They should be informed, be prepared, talk to medical professionals, and we'll take this one day at a time and not to be so anxious about this.
Important points made. Dr. Gendlina, your thoughts?
Yeah, so I would second that. I completely agree. And my one message is please wash your hands.
It's a message we've been hearing a lot about over the past few days, an important one for all of us.
And worth repeating.
Out there, exactly. And as I mentioned, a lot of information out there right now about coronavirus. So before we get to some of the calls that are coming into the newsroom right now, we're going to turn it over to News 12's Shari Einhorn to tell us what's fact and what's fiction when it comes to COVID-19.
I think that there's too much confusion and chaos and the people should calm down.
It could spread and everybody's going to get sick and die.
I'm not really that scared. It's like the flu, but I still hope I don't get it.
There is so much information and misinformation currently out there about the coronavirus. It can be pretty hard to tell what's true and what's not. So we're answering some of your most common questions. If I get the coronavirus, I'll know, right? False.
In the milder forms, it's going to look and feel just like a common cold or a mild flu.
Wearing a surgical mask will protect me from getting the virus. False.
If I'm sick, I will wear a surgical mask across my nose and mouth so I would prevent my germs from reaching you. They're not meant to prevent other person's germs from getting into me.
I'm safe if I wear the same kind of mask healthcare workers are wearing. False. Healthcare workers wear the disposable N95 masks that are specifically fit tested for them.
If you don't have the right size, if you don't have the right shape, if you have a beard, if you have stubble, if your face has a narrow chin or wide cheeks, if there's any way to let air get through the edges of it, if it's not a tight seal, you're wasting your money.
I should be worried about getting letters and packages from China. False. At this point, experts say it's highly unlikely the virus could withstand the lengthy trip from China on porous surfaces like paper or cardboard. Antibiotics don't work to treat coronavirus. True. Doctors say there is no medicine to treat the virus, only the symptoms. There's a vaccine coming soon, right? False.
There may be a vaccine coming. There's a lot of places that are working on it. It's likely going to be at least a year.
Thermal scanners at the airports can detect someone who is infected. False. Scanners do show if somebody's body temperature is above normal, but don't explain why. Will warmer weather stop the spread of the virus? Unknown. Doctors say they just don't know enough about this virus to say what will happen.
We have yet to understand how well it will or will not transmit once the weather changes.
Oh, and just to be clear, the only thing that Corona beer and the coronavirus have in common is the name. I'm Shari Einhorn, News 12.
Just in case we needed that.
A moment of levity when we're talking about a serious topic here. Doctors, what is your reaction to some of the myths that were debunked and some of the facts that were discussed in that piece?
Well, so I think this is absolutely correct. I think there are definitely a lot of sort of anxiety-driven questions that have been very well answered here as being really not true, not relevant, not really at all in the context of what's happening now.
Yeah, I mean, the points made about the masks were very important, I think. I think a lot of people have a lot of misunderstandings about the utilization of masks. Masks are to be used by health professionals, certain kinds of masks that can actually be dangerous for people if they're not fitted properly for those masks. And masks are otherwise to prevent people from giving other people things rather than to prevent people from getting things. So we really don't advise it right now.
That's what we've been definitely hearing from city and state officials as well, and now we're hearing it from the health experts as well. So thank you for that. We do have our first caller of the night. It's Diamond over in Brownsville, Brooklyn. Diamond, can you hear us?
Yes, I can hear you.
Amazing. What is your question tonight for the doctors?
Yes, my question was, am I still able to order from online? Because most of the stuff that I order from is from China. And I would like to know if I could still order things online.
Great question.
See, that's just the sort of thing I think people need to go about their daily lives. You really don't have anything to fear from that sort of thing. It's very, very, very unlikely that a virus, even if it got onto the surface of that item, would survive the trip to the United States and pose somehow a problem to you. So, again, I don't see that as a threat at all to you.
Yeah, I would definitely not worry about getting any infection, the coronavirus, from anything you received in the mail, from any sort of online ordering, even if it comes from overseas, from countries that may be identified as having a higher prevalence of coronavirus.
Okay. This conversation is also taking place on social media, so we do want to get to News 12's Christy Reeder, who joins us now with more questions that are coming in the comments there, Christy.
Yeah, we put this question up there. Hey, what questions do you have for the medical expert? And a lot of you writing in, and it's great because you have an expert to tap into their knowledge. So we want to get to our first question that we pulled from our Instagram page that we want to get to tonight. And the viewer, you can see, writing in saying, what is the recovery rate for a healthy person while under care or personal quarantine? And let's let the experts answer.
Quarantine is at the moment defined as a 14-day period. It's not really a recovery period so much. We put people in quarantine in order to manage and monitor them and make sure they don't get active disease. And so what we do is we wait an incubation period to see if the individual is going to come down with symptomatic disease. And as we understand it right now, the long end of that period is 14 days. The incubation period, honestly, is probably much shorter than that, but some people may take 14 days.
So that 14-day, which is what we've been hearing a lot from the officials, is kind of the message that we're getting out here in terms of that quarantine time.
Yeah, if you're identified as an individual of concern and you may have been exposed, but you're not sick, then the health professionals will tell you to remain in some environment, usually at home, for those 14 days. If 14 days have passed, and you haven't developed symptoms, it isn't likely you're ever going to come down with anything.
Good to know. Really good to know. Thank you for that. And great question, too. We also have Diane on the phone now from Bergen Beach. We want to get to her question. Diane, can you hear us?
I can.
Amazing. Thanks so much for calling in this evening. What's your question?
My question is, can an infected person spread the virus through bodily fluids other than mucus, like blood or sweat?
Great question.
So that's an excellent question. And the answer is we don't really know. So the most common way of spreading is really respiratory. It's a respiratory virus, so it's really transmitted with respiratory droplets. Whether it's found in other body fluids and what the transmission rate of that, if at all, we really don't know.
I would agree.
Yeah,
Right.
it's something to keep in mind too. I mean, this is obviously so much developing here in our city, but across the world and in your profession as well. So it's another thing to keep in mind that we are learning a lot, and
Yeah.
so are you.
A lot to be learned. We want to get back to some of those questions that are coming in on social media now, so let's hand things over to Christy, who has another comment and another question from one of our viewers. Christy.
Yeah, Amanda, a lot of great questions coming in on social media, and be sure to head to our Instagram, Facebook, Twitter. We want to hear from you, and you have experts to tap into. Like I said, they're great. So this is a great question, I think. We have it coming from our viewer, Colbert's by Marilyn. If you get it once, are you immune? So if you get coronavirus, once you recover from that, are you immune from it? Let's get to our experts now.
That's a great question, and just like the last one, I think we don't really know. I mean, one thing that has to be understood is that coronaviruses are actually very common in nature. Many of the cold viruses that many of us suffer in the wintertime are actually coronaviruses. This is a different type of coronavirus, but I think it's well recognized that we can get infected with coronaviruses over and over again, and we don't seem to develop long-standing immunity. So my guess would be that we probably could get it again, but I don't know that for a fact.
So one of the things that probably still needs a little bit more further research as we continue to look into
Right,
the
as we
effects.
see this disease, you know, we'll see people who have it and then people who get exposed again. I think it'll just be something that plays itself out for us.
A lot to be learned here, and a lot to be learned here tonight in asking our questions. So we thank the two of you for being here. We are going to take a quick commercial break, and then we're going to get right back to all of those questions that are coming in via the phone, via social media, on Facebook, online. So be sure to call into that number that we mentioned here before, and then of course head on over to our Instagram and Facebook pages that we're also monitoring.
Number to call is 718-861-6827. We'll be back. Welcome back to this News 12 special report on the coronavirus outbreak. I'm Jessica Cunnington.
And I'm Amanda Bossard. We have two medical experts joining us now in studio, Doctors Michael Augenbraun and Inessa Gendlina. Thank you so much for joining us. The phone lines are blowing up with questions right now, so we do want to hand it over to them immediately so we can get those questions answered.
We've got a lot of people waiting. We're getting to Aisha over in Brownsville, who has a question about enrolling your child in daycare. Aisha, can you hear us tonight?
Yes, I can hear you guys.
Amazing. What is your question?
My question is, I have a concern about putting my 3-year-old into daycare given the new outbreak. Should I leave her at home to stay with her grandmother, or should I put her in daycare?
Great question.
Sure, so that's a very good question, and there's really no restrictions right now. There's no reason, there's no evidence why children shouldn't be proceeding with their normal child development, so childcare, daycare, schooling, unless there's some specific reason or specific recommendation from sort of a governing agency like a city department of health or state department of health. There's really no reason to implement anything else that you would normally not be doing. So if this is the time for your child to be going to daycare, by all means, that's part of their child development.
Absolutely agree.
Great. We have more questions coming in on the phone lines right now. We want to get to Mitchell from Bay Ridge, Brooklyn. Mitchell, can you hear us?
Yeah, I sure can. Can you hear me?
Yes, we can, Mitchell. Go ahead and ask your question, please.
So, what's going on with these trains? Can I stop going to work?
Wait, say that question again? I'm sorry.
He said,
Are
what's
the
going
trains,
on?
Are the trains safe or what?
Yeah.
I travel probably the same way you do on the R train every day. And the trains are safe. We have no evidence right now, any epidemiologic evidence that people are contracting disease on the train. I know a lot of people travel on the train wearing masks, but again, that's probably not appropriate. It may make them feel better and safer, but it's not doing anything. Granted, the trains are crowded, all sorts of people are there, some people may be sick or something like that, but the amount of time that any one person spends on the train, even in that crowded environment, is probably not likely to transmit disease efficiently. I would say, on the other hand, when you come off the train, you've touched a lot of surfaces, as have other people. You should wash your hands, use alcohol hand preps, use soap and water, and you should be fine. And I would go about my daily business. I have not changed my commuting practices.
Same, and we've heard from the mayor really all week, really driving home the sense of casual contact and using the subway as a big example of that. You know, we're on the train for whether it's 10 minutes, 5 seconds, or a half hour on your commute. All of that is casual contact and therefore cannot be transmitted during that time.
Right, I would agree.
Okay, good to know.
Yeah, I completely agree, and I would second the hand washing part of it.
Yeah,
And that's when that comes into play. Yes, frequent.
We do have another caller on the line. This is Karen from the allergen section of the Bronx. Karen, can you hear me?
Yes, I can.
Great. Karen, what's your question?
My question is, I'm a cashier, and hundreds of people pass by me every day. Should I be concerned? I don't know who have corona because they don't show up as symptoms. So I'm a cashier, and I'm very concerned about people passing by every day. Should I be concerned?
Yeah, so
Go ahead.
that's a very good question, and I will sort of ask this question back of, during a regular annual flu outbreak, is your practice any different? So, you know, we're in general at a average risk for what is around us, and again, it goes back to wash your hands while you're working. Don't touch your mouth, don't touch your nose, don't touch your face. If you finished your shift, start your break by washing your hands.
I would add to that, I think I agree. The risk is exceedingly low. I think, you know, we don't have any evidence of people contracting it in that sort of casual experience. I think if people in the community are sick, though, your employer probably should have signs posted. At least it would be reasonable and commonsensical to have signs posted in the workplace reminding patrons and staff to do just those things. Use a tissue, cough into your hand or your elbow, use, again, hand washing techniques, and I think you should be perfectly fine.
Great advice that everyone needs to keep in mind, especially
All
this
of
time
us.
of year. We do have another question from one of our viewers that we want to get to now.
So how do my mother protect her, because she's older and her immune system is lower?
Okay, so maybe some of the elderly in our communities, our parents, you know, people of a certain age that seem to be more susceptible to this. What should they do?
You want to?
Yeah, so my answer to that question, really, number one, make sure that everybody has had their flu vaccine, that everybody is really appropriately protected from the common things that are common, and we still have pretty significant number of flu cases going around. So the risk is probably higher in the elderly, but at this point, just common sense, really personal protection in terms of washing your hands and just not touching things that you wouldn't be touching if you haven't washed your hands anyways.
The only thing I would add to that is that I think we have to differentiate the risk of contracting the disease from the risk of the consequences of the disease. And I think the concern with the elderly and people with weakened immune systems is that if they get sick, the consequences can be more severe. I don't think we have evidence that they're likely to contract it any more commonly than other people in the community. So again, preventative measures are really important.
Key in this response.
Across the board. All right, well, we are getting so many questions. I'm so happy that people feel that this is an outlet for them to make them feel more aware, and as we've been talking about kind of all evening, stay informed because you feel stronger and more prepared in your day-to-day life. We're going to be right back here on this News 12 special report.
welcome back to this News 12 coronavirus outbreak special report. We are taking a lot of your calls right now, and we are asking your questions of our two medical experts who are joining us, and we do want to get right back to those calls. I believe we have Rachel from Riverdale on the line. Rachel, can you hear me?
Yes, I can. Hello.
And Rachel, it's my understanding that you are currently in quarantine right now.
That I am. I am in quarantine right now.
What is your question for these doctors?
So I'm just wondering, I as a pet owner, I love my dog, and I just feel so sad that she has to stay in here with me, and I'm just wondering, can I walk her? Should I be worried about her being affectionate to me? She's constantly licking me all the time. I'm not sure how to deal with it as a pet mom.
Great question, and something we've heard a lot about as this is developed. How do we balance caring for ourselves with the care of our animals?
Yeah, so that's an excellent question. So I believe the formal recommendations are if you're in quarantine, you should quarantine yourself from your pets as well as much as possible. Now, obviously, if there's nobody else who can take care of the pet, then if you have to, then you do what needs to be done. The recommendation is to really minimize exposure, so try not to cuddle as much as possible. There are recommendations, obviously strict hand hygiene, so wash your hands before you come in contact with your pet. Obviously wash your hands after. There's some recommendation if you're symptomatic to be wearing a mask when you're coming in contact with your pet. As far as walking the dog, so if this is a dog who is equipped and doesn't need to be walked, then they probably should stay indoors with you or with whoever is caring for the pet for the duration of quarantine. If they need to be walked, then just exercise common sense, your judgment, and really try to stay indoors in quarantine as much as possible, other than the basic necessity of that walk, if there's nobody else who can really do it for you. Yeah, but that's a tough question.
Somebody's supposed to be helping you when you're in quarantine. How's the caller getting food?
Something else that we're going to have to explore.
I mean, if there's somebody who helps, then somebody can walk the dog.
Real quick, right?
Yeah.
If that's the best, if that's the
Yes.
advisory
Yes.
or the suggestion, yeah. All right, good question.
Wow,
Another
yes,
good
and hoping
one.
she gets better and feels better soon.
Definitely. Thank you, Rachel, for that and for your question and calling in. Let's get to Marisol, who's on the line, I'm so sorry, Linda. So many callers on waiting, so let's get to it. Linda from Pelham Bay. Linda, can you hear us tonight?
Yes. Hi. Thank you. I don't know if you've covered this, but I was concerned when we say get the test if you have these symptoms or stay home. Where is the money for these tests coming from? Even if you have insurance, you have to pay for it. Who's going to? Are there any conditions helping this? Is this a call for Medicare for all? How does one deal with that? Stay home.
The financial concern, yeah.
The test is indicated in certain circumstances. The CDC recommends the test in certain circumstances. It's part of routine medical care, and so insurance should pay for the test. That shouldn't be an issue. I don't think anybody should be concerned about that. And it's available, and it will be available in all health venues, public hospitals, private hospitals, clinicians' offices. It shouldn't matter. The tests will be run. They are currently being run at the Public Health Laboratory at the Department of Health. So it should be really available to everybody who needs it, has an indication for it.
Okay, something for everyone to keep in mind should they feel those symptoms. We want to get to another caller on the phone right now, Marisol from Port Morris in the Bronx. Marisol, can you hear us?
Yes.
Great. Go ahead and ask your question to the doctors.
Hi, how are you? So my question is, I'm an asthmatic. My 6-year-old is severely asthmatic and is always hospitalized. So my concerns are, since they're mentioning that this is a respiratory disease, it affects more the respiratory, what should be my concerns?
Huge point.
Yeah, that's a good
that's
question.
a very good
Underlying
question.
asthma is a problem, and all sorts of respiratory illnesses seem to be able to trip off bronchospasm, which is what we call asthma. And I think it's a legitimate concern. I don't think we really have enough data to know how severe this virus in particular can affect asthma. But I would say that somebody who has underlying respiratory illnesses should take extra precautions, should be doubly careful in terms of exposing themselves to other sick individuals, and also should do everything they can to follow the precepts that my colleague has mentioned repeatedly, which is wash your hands, wash your hands, wash your hands. So.
And it sounds so simple, but I mean, you guys keep just driving home that point, so it just shows how important that simple thing is.
We've been talking about this for years. Washing your hands is probably the single most effective and simplest methods for preventing the spread of infections. And it's something our mothers taught all of us, but somehow we have the difficulty getting to it. So we have to remind ourselves of that.
When we're talking about washing our hands, we are talking about making sure that we do it for a certain duration. Just clarify exactly how we should be washing our hands, because unfortunately some of us forget at times.
So I'm gonna take this one. So it's at least 20 seconds of soap and running water, and if you want to figure out how to time your 20 seconds, you should be able to sing happy birthday to yourself at a reasonable rate at least 2 times to really get those hands clean. And if you're using a hand sanitizer, alcohol-based sanitizer, really make sure you get it on your palms, on the backs of the hands, and really rub it really well all over your surfaces, including wrists.
It bears noting and reminding, especially right now.
And Marisol, thank you for calling in with that question, because we know so many parents and so many kids and families are in your same exact situation and probably had that same concern. So very important. Thank you for bringing up asthma. And let's get to Christy Reeder, because just as much as the phones are buzzing, so is social media. Christy, what's going on?
Well, and you guys are taking great calls too. I can't believe we talked to somebody who was in quarantine right now. That was a crazy call. So glad she was able to talk to the experts. Yeah, let's get to more social media questions, because you guys have great ones. In fact, this next one I want to get to is one that I kind of have too, so I'm on the same page. So let's get to this latest one. This is coming to us from Facebook, and Augenbraun Cat saying, according to the CDC, hand sanitizer is not as effective as killing germs as washing your hands with soap and water. Also, if your hands are dirty or greasy. So I actually, and goes on to say too, hand sanitizers may not work because they can penetrate dirt. They can't penetrate dirt and grease like soap can. So I kind of have that question too to the experts. I want you to answer, what do you think is better, hand sanitizer or washing your hands? I mean, if you're in a pickle, can you do the hand sanitizer? Take it away.
I think you should do either or, you know. I think the point about soiled hands really requiring soap and water is important. But otherwise, either method is really recommended. So don't hesitate. If you don't have soap and water handy and you have Purell or other products like that available, make every use of them.
Yeah, so I think this gets to the point of sanitizing versus cleaning. So for cleaning and sanitizing, obviously soap and water, but for sanitizing, alcohol-based or soap and water, either is great, whichever one you can get to. And sometimes if you're on the subway, you can't really always get to a sink and soap, and hand sanitizer is perfectly fine.
Is there a certain percentage of alcohol that hand sanitizer should have in order to be deemed effective?
That's a good question. I'm not sure I know the answer to that.
But just make sure that
I mean,
you keep that
commercial
handy.
products, you know, by the major manufacturers are all acceptable to use.
Okay. So if you can get your hands on some of that, keep it with you and have it handy.
Yes,
when
a
you
lot of
need
people do that, right? I see a lot of people with their pocketbooks, and dangling from the pocketbooks is a little thing of alcohol hand sanitizer. Great idea.
Especially for throughout the day in our commutes.
Exactly. We want
to keep in mind.
Hand things back over to Christy. We have more comments coming in over on Facebook as well. Christy, what are people asking?
Yeah, a lot of great ones coming in, Amanda. This next one I want to get to comes to us from Wendy, and this is kind of asking how it can spread. How can coronavirus spread? So Wendy is writing in, can you get the virus from someone who has it but is not coughing or sneezing? Because, you know, we talked about what kind of contact do you have to have with that person in order to get the virus. So let's get to our medical experts with an answer for Wendy.
Go ahead.
Yeah, so the transmission is really droplet. So if somebody is not spreading droplet, you're not really likely to get it from them. Now, this is getting at a question of somebody who is asymptomatic carrier, are they able to transmit it? And I don't think we really know what the rate of that transmission really is.
Yeah, there are some diseases that we understand where spread can occur right before symptoms occur. We don't really understand the dynamics all that well of that. We don't really know if that applies that well to this condition. It's just one of those unknowns. So we wait for more data to come out on this.
And we'll keep us on tabs on that and keep everyone informed as that information becomes available and studies and research
part of being informed
is done. Exactly.
Thank you, thank you, thank you. And we were talking about before, you know, you guys are really obviously in this world just as much as we are. We're hearing so many updates from the mayor's office, from DOH, from the governor, but obviously in the medical world, you guys are learning so much on a day-to-day, hour-by-hour basis. So, you know, we were speaking before about how your phones are blowing up with updates, you know, from coworkers, from staff members, so you're constantly learning just as much behind the scenes as we are.
And there's a lot to still be learned about this.
Absolutely.
It is somewhat new concept to a lot of us, and obviously it's probably something that we will be dealing with for a little whiles to go.
Thank you so much. Again, great questions, great answers, all a part of all of us trying to become more aware about this coronavirus. We're going to get to quick commercial break, and we'll be back here for this News 12 special report.
And if you have a question, please give us a call. Our phone number is 718-861-6827. We have our two doctors here ready and waiting to take those questions. As Jess mentioned, excellent answers so far. So we're going to get to that commercial break, and we'll be back in just a few minutes.
Welcome back to this News 12 special report on the coronavirus outbreak. We have been getting so many questions online and on the phones, and we do have Deborah waiting tonight to ask her questions to our doctors right here in studio. So Deborah, we want to check in. Can you hear us tonight?
Yes.
Amazing. You're in Fort Greene, correct?
Yes.
Amazing. So what is your question?
Hi, I work in a New York City public school, and a lot of students come to school coughing and sneezing. Should I be concerned?
Great question, and something we've heard a lot about over the last few days.
Yeah, the students sneezing and coughing on somebody, that sounds not surprising, I have to say. Kids don't follow hygiene practices all that well. I think in and of itself, that's a risk for all sorts of different things. I think your risk for coronavirus at the moment, though, is probably pretty low. We haven't really heard about children as a source of disease significantly or spread in the schools. So I think you should be working with your students to make sure that they practice good hygiene, but I'm not sure I would live in fear that this is all about coronavirus. It's about a lot of things, but it's mostly about good hygiene.
Especially this is flu season too.
Yeah,
so I mean, just like we've been saying,
Yeah.
going to school and kind of just being around people in general, that's kind of top of mind, not necessarily coronavirus.
Right.
Yeah. So I completely agree. I wouldn't do anything that you aren't already doing every single day of being at work. So I would just wash your hands
and carry on.
Can't say that too many times.
Exactly. Thank you for that.
We do want to get to one of the other callers on the line right now, Gail, who I believe is in Ocean Hill. Gail, can you hear us?
Yes, I can.
Great. Go ahead and ask your question, Gail.
My question is, both my husband and my son works for the transportation system. They both work for the railroad. My husband is long haul because he works for Amtrak. And my daughter-in-law works at the hospital, the emergency room. How can I protect the home from, bringing in the virus into the home, seeing that all of them are more susceptible to the virus?
Great question. That concern about coming into contact with so many people over the course of the day and what that means for this outbreak.
Yeah, so that's a very, very good question. And I would just do what you would normally do. So again, really washing your hands when you come home, changing clothes, wiping high-touch surfaces. So whatever you would normally do, I wouldn't change your practice in any way just because this is a particular coronavirus versus a different coronavirus that we had 2 weeks ago, or influenza that's still all over the place. So I would just do the same thing that you would normally be doing.
Yeah, I don't think an employee of the railroad or the public transportation system is at any higher risk to bring something home than anybody else. So, I don't think people should change their routines on the basis of that. Again, good hygiene practices.
Definitely. And when we talk about, just quickly run through the high-touch surfaces inside our homes, because obviously your hands are number one because you're taking those with you throughout the day, of course, wherever you're going. And of course, washing right when you get home. But let's just quickly go through, the spots in the house that you should wash a little extra.
Yeah, so I think they commonly sort of forgotten or missed are the doorknobs, so all the doorknobs in the house. And the one thing that I would say, purse handles, your pocketbook, your bag
constantly touch
I don't know anything about that.
I would wipe those. So car door handles, steering wheel, your door handles when you come in, would be your really highest touch surfaces.
Great reminders
Just
with that.
keep it in
Wouldn't
mind.
think about it. We do want to get to another caller on the lines, Anthony, who is in the Soundview section of the Bronx. Anthony, can you hear us?
Yes, I can.
Great. Anthony, what's your question?
Okay. My wife and I have scheduled a trip to northern Italy in September. I'm 69 and she's 67. I want to know, should we cancel our trip because of the coronavirus?
A lot of people with this concern.
Good question. I think this is sort of gets down to what we understand about the disease and risk. Risk has been assigned based on certain epidemiologic characteristics, and that is to say where in the world you are. Right now, northern Italy is a hotbed of disease. We know that. As a matter of fact, I think recently the entire Italian school system has been closed to cope with the outbreak. It's hard to know what's going to be going on in September, though, so I'm not sure I would right now cancel the trip. It's something that you have to watch as it unfolds and develop, but sadly I say you may need to cancel because it may remain a problem and a risk for you and your wife.
Especially that northern section of Italy, which has
Milan,
been that
Venice,
hotbed for it in that country.
And really the CDC is taking control of those advisories, correct? So kind of keep checking throughout the summer.
Absolutely.
The CDC website, because the watch list areas will change. We might add, we might take away some of those countries.
They might relax it, in which case it may be very well safe to go. So.
Yeah, and I think I agree with that. I think we really don't know what's going to be by the time we get to September. I mean, the virus as we know it is only 2 months old, right? So December 31st is when we first heard of anything related to coronavirus. So I think it's really too early for us to make sort of any reasonable prediction in any near or far future.
Yeah, I think that's true. I mean, I think respiratory viruses spread most efficiently in the winter for reasons that are probably pretty clear. We keep the windows closed, we huddle together in closed spaces, and we stand a greater chance of spreading disease. And as summer comes along, these things are relaxed and spread lessens. But with new things like this, like coronavirus, H1N1 many years ago, we just don't know the dynamics.
Exactly, something that we're all going to have to keep an eye out for as we head into those spring and summer months and see what happens.
Yeah.
So it's something that I think we're going to be talking about for a while and just kind of monitoring really for a while. But thank you so much for that advice. I think that's really crucial to hear, especially if you have those trips planned out. We'll be right back. We're going to go to a quick commercial break and then we'll be right back.
Welcome back to News 12, and before we wrap up here for this special report, we do want to get to an important topic, because if anyone at home is feeling any cold or flu symptoms at all, we want to ask our doctors, what do you do right off the bat in the wake of the coronavirus outbreak here? If you're feeling like flu or cold symptoms, what do you do?
Well, first of all, those are very common symptoms right now anyway, and it may have nothing to do with coronavirus. I think the big question that people have is, should I rush off to the emergency room? And the truth of the matter is, the emergency room should really be reserved for emergencies, people who are acutely, seriously ill. And we run the risk, if everybody goes to the emergency room with minor cold symptoms, that we're going to flood the emergency room and impact negatively on their function. So most important, if you're feeling ill, call your doctor, talk to your doctor, don't rush the emergency room. I'm not sure they can offer you anything more than your doctor can.
Definitely an important thing to keep in mind. And so many great questions here tonight. We want to thank you so much for offering your expertise to answer them. The conversation right now does continue over on Facebook. We have Facebook Live going on right now. So if you had a question, you weren't able to get it answered, or weren't able to get through here on the air, you can definitely head on over to our Facebook page right now. That will be going on through at least 9 p.m. tonight, so you can head on over there, leave your comments, and hopefully those medical experts can get to them and get all of those questions answered, those concerns calmed a little bit. I think a lot of that has been done here tonight, and again, we thank both of you for being here, for advising our viewers on this important topic, and we thank all of you for tuning in and coming in with your questions as well. And if you have any other questions about the coronavirus outbreak, as always, visit us online at news12.com.